Ever felt like you just ran a marathon while simply climbing the stairs? Or like you're breathing through a straw even while sitting still? Well, congratulations. You've just met Dyspnea. Not a Greek philosopher, but definitely something that makes you rethink your lung capacity. Hey everyone, welcome back to DocDecoded, where we break down complex health issues into bite-sized, breathable chunks. Today, we're decoding dyspnea, the fancy medical term for shortness of breath. Fun fact before we start, humans can survive without food for about 3 weeks, without water for 3 days, but without air, just 3 minutes. That's how critical breathing is. What exactly is dyspnea? Dyspnea is the subjective sensation of difficulty in breathing. In simpler terms, it's when someone feels like they can't get enough air, even if their oxygen levels might technically be okay. It's not a disease by itself. It's a symptom. And just like a cough or a fever, it can be linked to dozens of conditions ranging from the very mild to the life-threatening. Think of dyspnea as your body's panic alarm. Something's off, and your body is begging for oxygen. Feeling short of breath or dyspnea is very common. It affects up to half of hospital patients and about 1 in 4 people who visit doctors regularly. Around 9 to 13% of people in the general population experience it. And this number rises to 37% in those over 70 years old. It's one of the top reasons people go to the emergency room, with millions of visits every year. Before we go on, have you ever experienced sudden breathlessness without any obvious cause? Drop your story in the comments. Let's learn from each other. Why do we feel breathless? Dyspnea. Feeling breathless isn't just about not getting enough air. It's more complicated. Different people may feel breathless for different reasons, even if they have the same illness. There are 2 main types of signals involved. 1. Afferent signals. These are messages sent from your lungs and breathing muscles to your brain. 2. Efferent signals. These are messages sent from your brain to your breathing muscles. If there's a mismatch between what the brain expects and what it's actually getting from the lungs, called efferent-afferent mismatch, we feel breathless. What sends the I'm breathless signal? Chemical sensors in your blood vessels detect low oxygen, high carbon dioxide, or high acidity. They send messages to your brain that make you feel like you're not getting enough air hunger. Stretch and pressure sensors in your lungs and chest wall detect if your lungs are working harder than usual, like in asthma, COPD, or lung stiffness. Blood vessel sensors in the lungs respond to high pressure or poor oxygen delivery. The brain sends signals to your breathing muscles to work harder. It also tells the sensory parts of the brain how hard breathing feels, called work of breathing. In diseases like COPD, even when you're trying hard to breathe, your body still doesn't get enough air, leading to breathlessness. Other factors like fear, anxiety, or panic can worsen this feeling, making you more aware of your breathing and increasing the discomfort. Ever had a moment where you felt breathless during an emotional situation, like stage fright or a breakup? Believe it or not, that's dyspnea too, the non-dangerous kind. Dyspnea can show up in different ways depending on its duration and trigger. Let's break it down. 1. Acute dyspnea, sudden onset, often minutes to hours. 2. Chronic dyspnea develops over weeks to months. It is defined as a symptom lasting longer than more than 1 month. 3. Exertional dyspnea happens only during activity. 4. Orthopnea, breathlessness while lying flat, especially common in heart failure. 5. Paroxysmal nocturnal dyspnea, waking up gasping for air at night. Each of these types offers clues to what's going on inside. Have you or someone you know ever needed extra pillows to sleep because lying flat felt suffocating? That might be orthopnea. Tell us in the comments if this sounds familiar. In ancient medical texts, breathlessness was once blamed on bad air or spirits sitting on the chest. We've come a long way since then. Now we blame the lungs, heart, blood, brain, and occasionally anxiety. What causes dyspnea? Let's get to the roots. Chronic or long-term dyspnea is most commonly attributable to pulmonary or lung-related and cardiac or heart-related conditions that accounts for as many as 85% of the underlying causes of dyspnea. 1/3 of patients may have multifactorial reasons underlying dyspnea. There are 5 major systems that commonly causes dyspnea. Tier 1, lungs, pulmonary causes. Asthma. Asthma is basically your lungs saying, I'm not in the mood to breathe today. COPD, chronic obstructive pulmonary disease, as in smokers. Pneumonia, following infection or inflammation. Pulmonary embolism, blood clot blocking arteries of lungs. Interstitial, lung disease. Inflammation and scarring of lung tissues. Hypersensitivity, pneumonitis, inflammation following allergic reactions in lungs. Imagine your lungs like air balloons. When they're inflamed, blocked or stiff, they simply can't inflate properly. No worries, we will come up with all these difficult terminology diseases one by one so that you can better understand. 2. Heart. Cardiac causes. Congestive heart failure. When heart fails to pump effectively, fluid can back up into the lungs. Myocardial infarction. Heart attack. Blockage in the blood supply to the heart muscles. Arrhythmias. Irregular heartbeat or pulses. Diseases of the valves. Ineffective opening and closing of valves of heart for unidirectional adequate flow. Cardiomyopathy. When heart muscles become weaker, thicker, or stretched heart can't pump blood. Constrictive pericarditis and cardiac tamponade. Building up of fluid around the heart. Any heart-related issues may cause breathlessness, often increases with exertion or lying down on bed and associated with edema. If you want to know more, check out the video on edema in I button. 4. Disease affecting the pulmonary vasculature. Pulmonary hypertension arises from a variety of underlying causes or chronic thromboembolic disease. 5. Disease affecting the chest wall. Bony abnormalities such as kyphoscoliosis. Neuromuscular weakness conditions such as amyotrophic lateral sclerosis, etc. 6. Blood. Hematologic causes. Anemia. Less hemoglobin, is less oxygen delivery. Even with normal lungs and heart, if your blood can't carry enough oxygen, you'll feel breathless and hence easy fatigue. Anemia is so sneaky, it can make you breathlessness and pale. A ghostly combo. Do you have low hemoglobin? You can watch the video on anemia attached at the end screen. It may be helpful for you. 7. Brain and nerves. Neurological causes. Stroke. When there is obstruction of blood flow to the brain. Guillain-Barré syndrome. A condition where your body's immune system mistakenly attacks the nerves, spinal cord injuries. If the brain or nerves controlling your breathing muscles are damaged, your lungs won't get the signal to work right. 7. Psychological causes. Anxiety, panic attacks, hyperventilation syndrome. Sometimes the brain perceives breathlessness even when everything else is functioning normally. Which of these systems do you think is the most common culprit behind breathlessness in people above 60? Drop your guess below. We'll reveal the answer soon. When someone has both heart and lung disease and treatment isn't helping, or it's unclear what's causing the shortness of breath, doctors can do a special test called CPET, cardiopulmonary exercise test. It helps figure out whether the heart or the lungs are the main reason for the symptoms during physical activity. The test usually involves exercising on a treadmill or cycle while checking breathing, oxygen exchange, and heart function. If during peak exercise, the person can breathe as much as expected, but still has trouble, like reduced oxygen, wheezing, or poor oxygen exchange, the lungs are probably the issue. On the other hand, if the heart rate goes too high, blood pressure behaves abnormally, the oxygen pulse, how well oxygen is used per heartbeat, drops, or the ECG shows heart problems, like poor blood flow, then the heart is likely the problem. This test can also sometimes point to muscle or metabolic diseases if neither the heart nor lungs seem to be the cause. When to worry? Red flags of dyspnea. Dyspnea is common, but when should it ring alarm bells? Watch out for these danger signs: chest pain or tightness, blue lips or fingertips, rapid heart rate or palpitation, confusion or fainting, coughing up blood, high fever with chills, sudden onset without exertion. These signs can indicate a medical emergency, like a heart attack, pulmonary embolism, or severe pneumonia. Don't try to walk it off. Call for help. If you're short of breath and Googling your symptoms, that's already 2 red flags. Have you ever thus gone to the emergency room for breathlessness? What turned out to be the cause? Share your experience. You might help someone else recognize it early. When you walk into a clinic complaining of shortness of breath, your doctor plays detective. A graded approach that begins with a history and physical examination, followed by selected laboratory testing that might then advance to additional diagnostics, may help elucidate the underlying cause of dyspnea. Here's the usual game. Tightness in the chest might mean the airways are narrowing, bronchoconstriction, like in asthma. Feeling unable to take a deep breath might be linked to air getting trapped in the lungs, which can happen in COPD, chronic obstructive pulmonary disease. Trouble breathing while lying flat, known as orthopnea, often suggests heart failure. It can also happen if the diaphragm isn't working well due to obesity or acid reflux. Breathlessness at night or nocturnal dyspnea can be a sign of heart failure or asthma. Sudden short episodes of breathlessness may point to heart-related issues, like poor blood flow to the heart, myocardial ischemia, asthma attacks, bronchospasm, or clots in the lungs. Pulmonary embolism, ongoing long-term breathlessness, is more typical of conditions like COPD, interstitial lung disease, or chronic blood clots in the lungs, chronic thromboembolic disease. If someone feels breathless while sitting or standing, but feels better lying down, known as platypnea, it may be due to rare conditions like atrial myxoma, a heart tumor, or hepatopulmonary syndrome when there is a lung complication from liver disease. Vital signs like temperature, blood pressure, and pulse help doctors guess the cause. Fever could mean an infection or inflammation. High blood pressure with signs of heart failure may suggest the heart isn't relaxing properly in diastolic dysfunction. Fast heart rate or tachycardia can happen due to fever, heart issues, poor physical fitness, or other reasons. Low oxygen levels at rest might mean problems like poor oxygen exchange in the lungs. Due to fluid, clots, or lung disease, oxygen drop with activity can also be a clue that something's wrong with lung function. Doctor, look for the signs that breathing is harder than usual. Neck muscle pulling in, supraclavicular retractions because of using extra muscles to breathe. Leaning forward with hands on knees, tripod position, a classic sign of severe breathing difficulty due to stiff lungs or airway blockage. Swollen, rounded fingertips, clubbing, could indicate long-term lung problems like lung scarring or damaged airways. Swollen or misshapen joints or color changes in fingers in response to cold Raynaud's disease might point to autoimmune diseases that affect the lungs. Basic tests doctors may ask you to do for this: chest X-ray, ECG, electrocardiogram, blood tests, CBC, troponin, BNP, pulse oximetry, and arterial blood gas, ABG, spirometry, or pulmonary function test, PFT. Advanced tests like CT scans or echocardiograms may be needed if the basic ones don't give clear answers. Have you ever had a pulmonary function test? What was the weirdest part? Blowing into the tube or trying not to cough mid-test? Treatment depends entirely on the cause. For lung problems like asthma, COPD, inhalers, bronchodilators, steroids, antihistamines are useful. Pneumonia, antibiotics and rest are primary treatment. Pulmonary embolism, it is an emergency and need blood thinners. Hospitalization. For heart conditions like heart failure, diuretics, ACE inhibitors, beta blockers slows down the progress of damage. Heart attack. It needs emergency care, stents, blood thinner medications. Anemia, iron supplements, dietary changes, or blood transfusion in severe cases. For anxiety, breathing exercises, therapy, SSRIs if needed. General supportive measures you can adopt to release your suffocation, like positioning. Sitting upright helps. Breathing exercises, pursed lip breathing, reduces anxiety. You can try deep breathing during symptom-free time, avoiding triggers like allergens or smoke. Never forget to carry inhaler with you in case of asthma, bronchodilators if you're already a diagnosed case of dyspnea. Always keep them ready at your home for nebulization. Oxygen therapy may be needed in many seriously ill cases. See, not too many things you can do on immediate basis except going to emergency department. So better get diagnosed when the symptoms are mild and also adopt lifestyle to prevent. How can you prevent dyspnea? While not all causes are preventable, some steps definitely help. Quit smoking. Seriously, just quit. Stay active. Build lung and heart capacity. Control BP, sugar, cholesterol to prevent heart disease. Eat iron-rich foods. Combat anemia. Practice stress management. Yoga, meditation, Netflix. Maybe not medically approved, but still relaxing. What's one lifestyle change you've made that improved your breathing? Share with us. Your tip might inspire someone else. So the next time you're gasping after chasing your dog or running upstairs, take a moment to think. Is it just exertion or something more? Shortness of breath is never something to ignore. It's your body's way of saying, hey, check under the hood. Whether it's the lungs, heart, blood, or mind, there's always a reason behind the symptom. If you found this episode helpful, give it a thumbs up and don't forget to breathe and subscribe to DocDecoded for more clear, engaging medical content. Got questions? Drop them in the comments. I'd love to hear from you. Until next time, keep breathing easy and stay curious.